My name is Josh Gentis. I'm an associate professor and research director for Oklahoma University's Department of Emergency Medicine. And I've been taking care of COVID patients at the Hillcrest Medical Center for the last year and a half roughly. It's not going to get better anytime soon, I can tell you that as well. And our hospital capacity, while strained over this whole period of time, is now going to get to the point where it's worse because people are leaving. Nurses are leaving. We have a problem now, and it's this new variant, the Delta variant. This is no joke, guys. It spreads faster, so your response to it has to be quicker and more thorough.
Delta is COVID-19 on steroids. Everybody should be vaccinated. Who can be vaccinated? Mask, watch their distance, and wash their hands. And that's the only way we're truly going to be safe.
And Delta makes you sicker. Young adults are at twice the risk of hospitalization compared to the previous dominant variant of this virus. And across all age groups, hospitalization and mortality is worse. That's fairly new data, but that's what we're seeing.
Good news is that every week in July we saw a slight uptick in vaccinations. The bad news is that even with Delta, certainly what it was, we still gave more vaccinations in June than we did in July.
It's putting children in hospitals at a really fast rate. That is what you call exponential growth, and there's not a way for that to end without doing stuff to protect our kids. I think that's an important thing that we need to think about. So what that means with the new Delta variant, as fast as it transmits between people, because it's 2 or 3 times faster to transmit than the original version of this virus. As fast as it spreads, that just means we have to have more people who are immune to it to reach what they call herd immunity. And all herd immunity means is that the virus doesn't have enough targets to grow. So the vaccine is the first layer, and then the second layer is masking. And masks work. The data on that is incontrovertible. But it turns out that mask mandates work in Oklahoma. The Oklahoma State Department of Health looked at this in October last year and found that the growth of COVID cases in places where they didn't have a mask mandate in Oklahoma was 88% over the time period they studied. And in areas where there was a mask mandate, the growth was only 21%.
68% of their patients are coming from outside the city of Tulsa. And our other 2 hospitals, between 35 and 30% of the patients are coming from outside of the city of Tulsa. We've got to get everyone in Tulsa County to understand that this is the best thing we can do to keep people safe so we can get past this.
And if we had followed public health recommendations from the beginning, we would not be talking about this tonight. We would all be at home.
346 Tulsa County residents are infected each day. So once they're in the hospital, then they ask for the vaccine. It's too late.